Hello, I'm Antoni Chan reporting for Room Now here at ACR 2025 in Chicago. One of the questions that we need in psoriatic arthritis is head-to-head studies where we can compare the efficacy of biologics with each other. And this is particularly so in the area after a patient has failed TNFα inhibitor. And today there was a late-breaking abstract, which is LB06, which is a study that comes from Germany which addresses this question. In this study, they studied patients who had failed TNF, and then they were either randomized to either having Secukinumab or Ustekinumab. So the comparison was to see whether at the end of this study, whether they had improvement in their health assessment questionnaire. The HAQ-DI score was used as the primary outcome, and also they look at other scores including joint counts. There were 119 patients randomized equally 1-to-1 into either the Secukinumab group or the Ustekinumab group. All these patients met Casper criteria for PsA, and the mean age was around 53 years. There were some patients who had a higher body weight of greater than 100 kilogram, roughly about a third in both groups. And the features were then analyzed in the results section. These patients had the efficacy outcome, which is the primary outcome, which is the HAQ-DI. And at the end of 28 weeks, the patients who were randomized to Secukinumab, 57% of them achieved the HAQ-DI compared to 27% in the Ustekinumab group. The patients who were also in the Secukinumab group also had better results in terms of their secondary outcomes, which were the joint counts, the pain scores, skin outcomes, and also the patient-reported outcomes. These improvements were seen very early by week 2 and were sustained up to week 28. There were no new safety signals for the Secukinumab and Ustekinumab groups other than what is known in previous studies, and these were well tolerated. What I took away from this study is three things. Firstly, that there are differences in terms of choice of treatment in our patients after TNFα inhibitor. Secondly, these changes can be very beneficial and meaningful for the patients in all the factors that affect these patients with psoriatic arthritis. And I think this study called AGAIN is one of the many studies now that we will see where we can look at more head-to-head comparisons between biologic drugs, especially in this group of patients who may have failed some of the other earlier treatments, either conventional, synthetic, or biologic DMARDs. I'm Antoni Chan reporting here for Room Now, ACR 2025.